Later this morning, Governor Mills will host her 4th annual Opioid Response Summit in Bangor.
So the event is designed to gather healthcare providers, policy experts, law enforcement officials, members of the public, all to work together on this opioid crisis. Our Alex Haskell here with some details on the event and the latest on how Maine is doing in the fight against opioids. Hey, Alex.
Hi, Lee. Hi, Chloe. Good morning, everyone. So the Governor's Summit kicks off at 8 a.m. at the Cross Insurance Center in Bangor. The agenda includes a vast list of speakers, including White House drug czar Dr. Rahul Gupta, Maine U.S. Senator Angus King, and Governor Mills herself. I spoke with Maine's Director of Opioid Response, Gordon Smith, about Maine's opioid crisis. He says the pandemic has made it hard to get some Mainers treatment for their drug addiction. Smith says improvements still need to be made in recognizing substance use disorder as a chronic disease and not as a moral failing.
There's a reason that people use drugs. It's usually associated with adverse childhood events and trauma, and breaking down that stigma. It's incredibly important because many people who are using drugs don't even seek treatment because they've been so stigmatized.
Now, today's summit comes as a new report issued by the Margaret Chase Smith Policy Center at the University of Maine shows drug overdoses for the first 5 months of this year are up by 670 compared to the same period last year. And the opioid crisis is a bipartisan issue, of course. Republican State Senator Marianne Moore says lawmakers are working together to bring down the number of overdose deaths in our state, and she sees signs of progress.
A lot of it might have to do with a lot of the legislation that we worked on to make sure that Narcan was available, readily available out in the field.
Now, one of the issues that will be top of mind at today's summit is the rising number of overdose deaths linked to fentanyl. The state says as much as 75% of fatal overdoses in Maine this year involve the synthetic opioid, which is often mixed with other drugs. Alex Haskell, News Center, Maine.